Community Plan, submitted by Wendell Katangay, Herzing University, Community and Public Health Nursing, submitted to Professor Christine Williams. Community and public health play a vital role in health of an individual. Public health nurses assess, develop, plan, implement, and evaluate like what primary nurses do. Systematic approach is the key to effectively identify the need of a community to improve not only the health of an individual, but the whole community. Defining your community. So what is community? It is a collection of people who interact with one another and whose common interest or characteristic forms a basis for a sense of unity or belonging. My community is Village of Norwich, a rural community in the northwest suburb of Chicago with an approximate population of 15,251, a diverse community with predominantly white population. According to statistics, the Village of Norwich has increasing number of older adults and senior population. Windshield survey. Village of Norwich is a small community that has a lot of resources and opportunities for all the residents. A safe place to raise a family. A place where an individual can enjoy both rural and urban type of living. A fast-growing community in terms of all forms of businesses. Comprehensive plan for elderly population. The main objective of the comprehensive plan is to provide continued support to community senior population, allowing them to age in place. Community assessment population, the total population as of April 2021 is 15,251. Average median income is 72,570 per household. There is an increasing number of population in the community. The focus of this project is providing the best care for our elderly by way of providing them proper and correct information. Are my community partners and resources? Community partner versus the home health agency of all family healthcare, Administrator Dorothy Joy Balmaceda, who's a doctor, and with visiting nurse of all family, Norma Soto, licensed practical nurse, and my community resources is the Center for Disease Control and Prevention and the American Diabetes Association. What is nursing diagnosis? Nursing diagnosis helps nurses to see the patient in a holistic perspective, which facilitates the decision of a specific nursing intervention. A clinical judgment on an actual or potential health problem of an individual. It is used as a basis for formulating nursing care plan, interventions, and goals. Nursing diagnosis for my community project. Risk for unstable blood glucose among elderly patients of all family healthcare related to poor eating habits, as evidenced by poorly controlled blood sugar level. Goals or objectives. Short-term goals. First, the patient or patient's caregiver will be able to enumerate at least 3 signs and symptoms of hyperglycemia and hypoglycemia towards the end of the visit. The patient or caregiver will be able to perform a return demonstration on how to properly check the blood sugar using their own glucometer towards the end of the visit. And for long-term goals, we have the patient blood sugar will be controlled and glycohemoglobin A1C will be within normal range after 3 months. What will be the intervention for the previously stated goals? The nurse will instruct the patient or patient's caregiver regarding signs and symptoms of hyperglycemia and hypoglycemia. Second, the nurse will instruct the patient or patient caregiver on how to properly check the blood sugar using their own glucometer and will ask them to do a return demonstration. For long-term goal, the nurse will instruct the patient or patient's caregiver regarding prescribed diet, exercise, and medication compliance to control blood sugar level. What I did with my community project, first I did the assessment or research the community that I will work with. I started, browsing the internet and look for different home health agency in our community. I came across with this home health agency called All Family Healthcare, and they have good patient reviews and feedbacks regarding the services that they provide. I made my very first phone call to All Family Healthcare office, and I was directed to home health agency director named Dorothy Joy Balmaceda, who is a graduate of medicine in the Philippines. During our initial conversation, I presented to her our community project and voiced my interest in collaborating with their home health agency by providing some teaching materials to their field nurses that can be used. The home health administrator and I arranged an in-person meeting to discuss more about the community project the next day. I went to all family office and meet with the agency administrator and their other staff. I presented a draft of what was supposed to be the for my community project. The initial plan was to make presentation with the field nurses about a particular disease and provided them with teachings materials such as brochure, pamphlets, and handouts that they can be used with their patients. During our discussion, the administrator suggested if I can focus the topic on one of this specific disease. I told her that I am considering creating an educational material for type 2 TM. She told me, oh, that was a good idea. And currently they have patients who are still struggling managing their diabetes. I told her that I needed to do some research because I wanted to provide correct information to the patient and I must get it from reliable sources. The agency administrator is generous enough to share some information and tips on how to come with the effective educational material. Our first meeting was very productive, and we have agreed that the focus of community project will be type 2 TM, highlighting the most important topics and concern about the disease. I started with my research of type 2 TM. I went to the Center for Disease Control and Prevention website, browsed the topic about diabetes in general. I did some readings about it to clearly understand everything about diabetes. After that, I started focusing in type 2 DM. I take down some important notes that I can use in my community project. I also check American Diabetic Association website and check on different topics that I can probably include in my community project. I focus mainly researching about the different tools that are readily available and accessible to the community. After doing all my research, I started putting all the information together and wrote a draft. I have decided my educational materials. I will be preparing the brochures and handouts that will be distributed to the field staff of all family. I started putting up all the ideas and taking notes on the step-by-step procedure. I called the agency supervisor of family and discussed her the content of educational materials. We talk about the design that we will use for the brochure for the nurses and patients. We also talk about PowerPoint presentation for the field staff and patients. I told her that as soon as I am done with the PowerPoint, I will forward it to her for final approval. I started creating the brochure using Canva, created my own design, and added some photos and most important information about type 2. In the brochure, I included the definition of diabetes, most common symptoms, the risk factors, the goal of this project, and the important thing to know about for those living with diabetes. I started doing the handout. I picked the most important information to be remembered about diabetes, highlighting the most common type, which is type 2 diabetes mellitus. In the handouts and different types were in diabetes were enumerated, the different tests in diagnosis diabetes, common symptoms and complications of diabetes. I also included the different symptoms of hyperglycemia and hypoglycemia. Treatment and care are also part of handout, giving emphasis on different types of insulin and their actions. I also included tips on how to use blood sugar meter or glucometer. I did more research on American Diabetic Association and came across the topic about diabetes and food care. Since I will be focusing on providing education to the elderly population, I have decided to include food care in my educational material. I have included in the handout on how to prevent diabetes-related food problems. I also included in the handout the lineup programs of AGA and CDC about type 2. This includes living with type 2 diabetes program, diabetes food hub, and diabetes self-management and support. We also created the PowerPoint presentation for the field nurses and patients based on the information I have put in the brochure and handout. After I am done with the PowerPoint, brochure and handout, I contacted the liaison and emailed her the PowerPoint presentation, brochure, and copy of handout for final approval. I also told her to criticize or feel free to make some comments and suggestions so that I can provide the necessary correction if needed. After our brief conversation, I emailed the PowerPoint, brochure, and handout to the agency. The following day, the administrator responded to me through email saying that it was approved, and she was very impressed with how I presented it. She invited me to attend the nurses' monthly meeting to be able to present the community project to the nurses and do the PowerPoint presentation. I attended the monthly meeting of All Family Health Care and did my PowerPoint presentation. I discussed with the nurses the purpose of community project, what are the goals of this project. I informed the field staff that I am one with them in raising awareness about type 2. I also discussed with agency supervisor my intention about working directly with nurses in the field. If possible and the patient will allow to, I will go with the nurse when doing a regular visit. So I plan my day accordingly. I work with one of the field nurses named Norma Soto. I went with her and see two patients on the first day. As soon as I arrived at the patient's home, I introduced myself, informed them the reason why I am visiting with her regular follow-up nurse, and present to them the community project. I gave them the brochure, handouts, presented the PowerPoint, and began educating them about type 2 DM. For those patients who are administering insulin, I instructed them the proper way of administering the medication. I also gave emphasis on checking blood sugar level as ordered by the physician and give them some tips on how to properly use glucometer and have them do the return demonstration. I also emphasize the importance of keeping record of all blood sugar readings for future reference when the patient goes to the primary care physician or endocrinologist. Most of the patients and their caregiver verbalize understanding about the education provided them regarding type 2. I have observed some patients needed reinstruction due to continuous bouts of forgetfulness. The brochure and handouts that were given to them will be helpful in giving information and other resources. I went with Nurse Norma for 3 more days and met with 8 patients to complete my 10 diabetic patients. Receive education, PowerPoint presentation, and instruction like what was previously done with day 1 visit. I have observed that there are still patients who have been struggling with understanding about type 2 diabetes mellitus and will need frequent reminders. After completing the visits with 10 patients, I had final conference with the agency administrator. I reported to her the outcome of the visit, informed her that the patients were very pleased with the educational brochures and handouts that were given to them. Also able to inform the administrator of my personal observation about most common issues why patients are having a hard time complying with proper management of diabetes. Dealing with the elderly population is very challenging. They have to be given instruction in such a way it will be easily understood. CDC and American Diabetes Association are excellent sources of information that I use for my intervention. I have gathered all the information about type 2 diabetes mellitus in CDC, and I have used the information about diet and other resources that the patient can use in American Diabetes Association. Evaluation. So health information is usually conveyed through patient education or counseling delivered by healthcare providers. Part of the understanding of educational communication is imperative to assist older patients in performing better care. So after the project was implemented, there has been lots of good response from the field nurses, the patients, and caregiver. The nurses have been distributing the teaching materials to their older other patients, and they use it as a resource for their teaching and documentation. The purpose of the response of the patient and their caregivers are all positive, and they were able to verbalize the signs and symptoms of hyperglycemia and hypoglycemia and was able to do a return demonstration on how to properly use the glucometer. For the long-term goal, we need to wait for at least 3 months to check their hemoglobin A1C. If it did, go down, by patient family verbalize that they would utilize the resources that I have incorporated in the teaching materials. The outcome of this project is favorable and beneficial for all family healthcare patients. So therefore, providing proper and correct information remain to be the best tool in providing quality healthcare for elderly population. In conclusion, community projects are beneficial to the community. It is very helpful and useful in raising awareness, especially for the elderly population who are the most vulnerable. In this community project, it shows us the importance of knowing our community and identifying the resources that the community have for the residents. Nursing diagnosis is also used in the community to set up plans, interventions, and goals to treat and address the community healthcare problems. Providing the community with available community resources like American Diabetes Association and Center for Disease Control and Prevention. Advocating for the elderly population is showing them that the community values them. That's it. Thank you so much. Have a good day.